Hi everyone, this is Ipshita Bhattacharya, and today we will be seeing clinical approach to anemia, and this is with reference to pediatrics undergraduate level. You can find an easier reference if you follow the Piyush Gupta book, because this chart is actually taken from there itself. Let's proceed. So clinical approach to anemia can be easily divided into two basic things. Those are that without bleeding and with bleeding. Okay, when we do this clinical approach to anemia, the sole purpose of making this chart and learning the scenarios is because we want to think in a certain way while we are into practice. Now, without bleeding, we will further divide it into two halves. One is with hepatosplenomegaly. This stands for hepatosplenomegaly, or without hepatosplenomegaly. Same thing goes with bleeding, anemia with bleeding. With hepatosplenomegaly, without hepatosplenomegaly. Okay, now anemia without bleeding, without hepatosplenomegaly, the first thing that comes into mind is nutrition, malnutrition or iron deficiency. Second thing can be a renal cause, maybe erythropoietin insufficiency, might be some other causes also. Can be pure red cell aplasia, can be chronic inflammation, right? So these are without hepatosplenomegaly. Now without bleeding and with hepatosplenomegaly can be hemolytic diseases, very commonly thalassemia. Now let's move to clinical approach to anemia with bleeding. Without hepatosplenomegaly can be bleeding disorder, can be loss of blood because of accident. Any reason can be there to the loss of blood, chronic loss of blood, chronic diseases, or coagulation factor deficiency, coagulation disorder. Now anemia with bleeding but with hepatosplenomegaly, we will look for neoplasms, leukemia, lymphoma, aplastic anemia, it can be liver causes, it can be hypersplenism. I might have missed out some points or the other, but this should do. You can refer to this chart before your Viva, before anything. And most importantly, we should keep this in mind because it gives us a detailed approach to think in a clinical scenario. Thank you.